Good afternoon, Professor. Welcome to Week 4 assessment. I'm here once again with my patient Bear Bear. Hello, Bear Bear. How are you doing today? Great. My name's Richard Van Dyke. I'm a nursing student from Chamberlain College. I'm here to do my Week 4 assessment. Is that all right? Bear Bear gives his consent. All right, Bear Bear. How are you doing today? Any pain or discomfort? Bear Bear states he has no pain but only feels love. All right, Bear Bear. I'm going to do my assessment. It should only take about 5 to 10 minutes. Is that all right? All right. Bear Bear, would you mind telling me your full name? He states his full name is Teddy Bear. Bear Bear, would you mind telling me what day it is? Yes, it is Friday. Would you mind telling me what time it is? He says approximately 2 o'clock in the afternoon. Bear Bear, would you mind telling me why you're here? He recognizes that he's here for an assessment. I'm going to go ahead and say Bear Bear is A&O times 4, as well as noting that he is dressed appropriate to time of year. He also appears to be a well-nourished, well-groomed Bear Bear. Bear Bear, would you mind if I start my assessment and me placing my hands on your head? All right, thank you. Any pain with this? No? Okay, how about this? All right, perfect. I'm going to go ahead and say that Bear Bear stated that there was no pain upon palpation. Also, I'm going to note that the hair for Bear Bear is even and distributed well. All right, Bear Bear. Any pain with that? No? Okay. All right, Bear Bear, I'm going to go ahead and check your temperature now. Bear Bear is approximately 98.5 degrees. He is well within normal limits for a temperature range. All right, Bear Bear, I'm going to go ahead and I'm just going to make a small pinch right here. He is negative for tinting. Skin turgor is perfect, so I'm going to go ahead and say he's properly hydrated based upon that. All right, Bear Bear, do you mind if I check your pulse? Perfect. All right, I'm going to go ahead and say Bear Bear's pulse is around 68 beats per minute. Also, half that time was spent watching respirations without Bear Bear's acknowledgement. I'm going to say he's around 14 respirations per minute. Also, I note that there was equal rise and fall to his chest bilaterally. All right, Bear Bear, I'm going to go ahead and check your pulse ox. Pulse ox states that he is 98% saturation off of room air and also confirms my heart rate for him. All right, Bear Bear, thank you very much. So we've taken your temperature now. Skin, I'm going to go ahead and check. Skin feels normal to palpation upon feeling with the back of my hand. Any pain so far? All right, great. Thank you, Bear Bear. So I went ahead and palpated his scalp already, assessed for hair. Let's see, I also palpated his sinuses. He stated no pain upon palpitation to sinuses or pressure. All right, Bear Bear, I'm going to go ahead and check your eyes now. Is that all right? Okay. Okay, Bear Bear, just a pen light, so I'm just going to go ahead and have you look. All right, Bear Bear, fantastic. Would you mind following my pen for me, please? I want you to move only your eyes, not your head, and just follow the pen. Perfect. Bear Bear was able to follow the pen with his eyes accurately with accommodation. Also, while checking for his pupils, I will note that his pupils were equal, round, and reactive to the light. All right, Bear Bear, thank you very much. Let's see, I'm going to go ahead and check your ears now, all right? Inside the ears appear to be clean. Behind the ears, no lesions or any deformities noted. All right, Bear, I'm going to go ahead and perform a whisper test. Go ahead and turn around. I'm going to go ahead and proceed behind you. Actually, all I'm going to do is turn the bear around so that way I don't have to get up and I can stay within the video. Right now, I'm going to go ahead and perform. Ask you a word. Would you mind please restating it for me? Honey. Bear was able to repeat the word honey since he loves honey. All right, Bear, thank you very much. All right, how you doing so far? Everything fine? Great. All right, I'm going to pretend that my pen light is my tuning fork at this time. All right, Bear, I'm going to go ahead and place this tuning fork on top of your head. Do you hear that? Do you hear it in both ears? Perfect. I'm going to go ahead and say he's great for hearing for the Weber's test bilaterally. All right, Bear, now what I'm going to do is I'm going to do the same thing, but for each ear. Go ahead and tell me when you can't hear it anymore. Okay, he states that he can't hear it now. How about now? Perfect. Same thing for this other ear. Okay, he says now as well. So I'm going to go ahead and say he's testing positive for Rhine test. He can hear bilaterally. All right. Now I'm going to go ahead and check inspection of his nose. Bear, go ahead and lift your head up for me. Nares appear to be clear, moist on the mucosa, as well as septum seems to be midline. All right, Bear, since you can't move, I'm going to go ahead and show you how to do it. You're going to place your finger on one side of the nostril and follow that. Great. Now the other side. Perfect. How was that? Bear states that his nose is patent to airway right now. All right, Bear. Let's go ahead and check your mouth for me. Would you say ah? Okay, I'm going to go ahead and place my tongue pressure on there. Okay, I'm going to go ahead and say that Bear's teeth are all intact. Breath smells normal. Mucosa airway or mucosas appear to be moist. Tonsils were unseen, so no edema in the tonsils or no irritation, as well as noting that he is stating that there is no difficulty with speech. The fact that Bear's talking to me tells me that he has an open oral airway. All right, Bear, how you doing so far? All right. Now I'm going to go ahead and check your lymph nodes. Okay. Post, pre, occipital, jugular, gastrical, submandibular. All right. Oh, and your subclavicles. And after inspection and palpation of the lymph nodes, I'm going to say that Bear's lymph nodes are non-palpable with no swelling or edema involved. All right, Bear, go ahead and lift your neck up for me. His trachea appears to be midline. And upon palpation, his thyroid gland appears to be without swelling within normal size. Bear, how are you doing today? All right, great. All right, Bear, I believe that concludes this week's inspection. Thank you very much for your time. I appreciate it. I'm going to go ahead and wash my hands now as I leave. Thank you, Professor, and have a great day.